Starting with the abdomen and pelvis, the first lecture is about the planes of the abdomen. These planes are imaginary lines that help us divide the abdomen into different quadrants and regions. With the help of two lines, we divide the abdomen into at least 4 quadrants. And with the help of 4 lines, we divide the abdomen into 9 regions. So the planes that divide the abdomen into 4 quadrants include a single midline plane that passes vertically through the center of the body, and trans-abdominal plane that divides the abdomen horizontally by lying at right angles to the midline plane. The quadrants include, they are named as right upper, left upper quadrants, and 2 right and left lower quadrants, each quadrant having their own contents and organs. The 9 regions are formed with the help of subcostal, intertubercular, which are the 2 horizontal planes, and 2 vertical midclavicular planes. The midclavicular planes pass through the middle of the shaft of clavicle, and the subcostal passes through the inferior margin of the costal margin lying at the level of the 3rd lumbar vertebra. So it basically passes below the 10th costal cartilage on each side. Then we have the transtubercular or the intertubercular plane, which is again a horizontal plane that joins the tubercles on the iliac crests on either side of the midline, and it lies at the level of 5th lumbar vertebra. These 2 horizontal planes and the 2 vertical planes divide the abdomen into 9 regions, which are named as the right hypochondrium, epigastrium, left hypochondrium, right lumbar, umbilical, left lumbar, right iliac, hypogastric, and the left iliac. Each again having their, like the quadrants, having their own contents and organs. Another famous horizontal planes is called the transpyloric plane. The name is indicating it is a horizontal plane, trans referring to the horizontal direction. So this plane lies or passes through the pylorus of the stomach when lying in the supine position. So this plane is a horizontal plane that is marked midway between the jugular notch above and pubic symphysis below. And its vertebral level is that it lies at the level of the body of the 1st lumbar vertebra. The significance of this plane is that many abdominal organs lie at this level, and this plane is asked in the SAQs, and they usually require you to write a note on this plane along with enlisting the contents or the structures that lie at this plane. So the very important structures that lie at this plane include the pylorus of the stomach, as the name is indicating, self-explanatory. And then we have duodenal-jejunal junction, the neck of pancreas, and the hyla of the kidneys. The transumbilical plane, which is also called the intercristal plane, passes between the highest points of the iliac crest or on the iliac crest on either side of the midline, either lying at the level of L4 vertebra or in between L3 and L4 vertebra at the level of their intervening intervertebral disc. So the anterior abdominal wall, starting from outside to inside, going from outside to inside, we have skin, superficial fascia, deep fascia, muscles, fascia transversalis, extraperitoneal fat, and then we have parietal peritoneum. So these are the 7 layers that make up your anterior abdominal wall. First of all, starting with the skin, skin of the anterior abdominal wall has great clinical significance. You must know about the different aspects of the skin, which include the direction of its cleavage lines. Number 2, blood supply. Number 3, cutaneous innervation. Number 4, dermatomes. Number 5, lymphatic drainage. So these are the 5 subheadings that you must know in regards to the skin of the abdominal wall. Starting with the cleavage line. Cleavage lines, they are horizontally directed along the trunk of the body. They are constant. That means they are not going to change. Why are they important? What is their clinical significance? आपको पता है कि being a doctor, आपको पता है कि आपने अगर surgeon बनते हैं तो आपने incisions देने हैं. So the incision, the direction of the incision must follow the direction of the cleavage lines for cosmetic reasons. अगर आप cleavage lines की direction में नहीं देते incision, rather आप उसके obliquely या उसके opposite direction में at right angles लगा देते हैं अपना incision, तो क्या होगा? Massive scar, heavy scar की amount बहुत ज़्यादा बनने के chances होते हैं. Again, क्या मसला होगा patient को? Cosmetic reasons. उसकी जो cosmetics है, उसकी जो body की appearance है, that will be affected. और बाहर आपको पता है western side पे तो sue भी कर देते हैं इस बात पे. ये गलत incision क्यों दिया? So अगर आपने cleavage lines में incision देते हैं तो उसका फायदा क्या होता है? Healing जल्दी होती है. एक बात. दूसरी बात, scar का जो tissue होता है वो कम से कम बनता है और healing जल्दी होती है. So this is the clinical significance of the cleavage lines. Number 2, we move on to the cutaneous innervation of the skin of the abdominal wall. The cutaneous innervation, इसकी draw and label आती है, बहुत ज़्यादा नहीं. I would say 20 to 25% is asked in the examination. Cutaneous innervation, draw and label. MCQs में अलबत्ता पूछ लेते हैं. So nerve supply to the anterior abdominal wall is derived from the lower 5 intercostal nerves. So I hope you know what are intercostal nerves. Subcostal nerve, that is the other name for the 12th thoracic spinal nerve. Then we have iliohypogastric and ilioinguinal nerves. For the dermatomes, you must remember the location of the dermatomes of the abdomen. And that dermatomes, they are often asked in the examination as part of MCQs. The distribution of the dermatomes on the anterior abdominal wall starts with the xiphoid process. So T7 lies at the level of xiphoid process. 10th thoracic segment is very important, often asked in the MCQs during the professional examination. It lies at the level of umbilicus. And then we have L1 that lies at the level of pubis. Moving on to the blood supply of the anterior abdominal wall. Blood supply is of great clinical significance. It is not only asked, it is not only clinically significant, but it is a very important SAQ along with its clinical condition called caput medusae, asked very oftenly in the examination, university examination, professional examination. So let's see what is the normal blood supply, then we will discuss the clinical. Blood supply to the anterior abdominal wall is received from the cutaneous branches of the lumbar artery, superior and inferior epigastric arteries. So here in the diagram, you can see the superior epigastric and the inferior epigastric arteries. The venous drainage below the umbilicus is done by great saphenous vein, and above the umbilicus with the help of lateral thoracic vein, that is the tributary of the axillary vein. And also, generally, as a general rule, the blood supply, venous drainage, follows the major arteries, accompanying arteries. And above the umbilicus, you know that around the umbilicus we have various superficial veins, which are called the para-umbilical veins. These para-umbilical veins, they are of great clinical significance because when the venous drainage is blocked from the lower side of the body, that is the lower limbs and the lower abdominal wall or abdomen as a whole, these para-umbilical veins, they are swollen up and they form a very important collateral pathway to bypass the blocked lower venous drainage and directing the venous blood flow from the lower side of the body through para-umbilical veins to the thoraco-epigastric vein that connects the para-umbilical veins with the lateral thoracic vein. Here in this diagram you can see that this is axillary vein बेटे, this is axillary vein, और ये जो आपको vein unite करती हुई नजर आ रही है abdomen को towards the abdominal veins को with the axillary vein, that is called the thoraco-epigastric vein. This particular vein connects the superficial veins of the abdominal wall with the lateral thoracic vein or one of the tributaries of the axillary vein in order to bypass the inferior vena cava and portal vein and directly connecting the venous blood from the lower side of the body and with the help of axillary vein finally draining the venous blood into the superior vena cava and from there towards the right atrium. So the lymphatic drainage is divided into superficial lymphatics and deep. The superficial lymphatics above the umbilicus passes through the axillary lymph nodes and below the umbilicus passes to the superficial inguinal lymph nodes. The deep ones, they follow the main arteries, which are the parasternal, lumbar and external iliac nodes.